Okay, let's go ahead and start. So, of course, we would want you to introduce yourself. So, what's your first name?
Temple.
Temple, what area of the country do you work in? What
I'm in the Midwest.
in the Midwest? So, of course,
Yep.
the United States. So,
Yep.
and then, if you'll forgive me, I will use a little bit of cheat. I always say that when I do videos because if I don't, the videos are going to last 4 days. So, tell me, let's see. Tell me a little bit about your work history. I mean, what's your experience?
I have 27 years of nursing experience.
Okay.
I got my LPN in 1994. I worked in nursing homes, home health, the hospital, went back to school, graduated with my bachelor's degree in 2000.
Okay.
I did home health. I did hospice. I did chemotherapy. I did med surge. I worked the floors. I did house supervisor for a while. I've done intensive care unit, specifically the last 10 years.
10 years. All
Yeah.
right. So, one of the beautiful things about nursing is there's so many things that we can do with it. So, that's
Absolutely.
definitely a plus. So, your history sounds a little bit like some of the adventures I've gone on myself with my career.
Right.
So tell me, where were you working when they actually declared the pandemic?
At the hospital that I'm currently at in the Midwest in Nebraska.
Okay, and what area of the hospital?
Intensive care unit, charge nurse.
Okay, so it's definitely safe to say that you were you couldn't get much deeper in COVID patients. Yeah, yeah. Okay, all right. So tell me, and this might be kind of an awkward question, but we'll see how it goes. But what made you want to do the interview?
I think I have a lot of experience under my belt,
Mm-hmm.
but I also see that some of the lesser experienced nurses or those that have been maybe in nursing less than 5 years, it's hard to convey where you pull strength from, where you figure out what you're made of, where you figure out how you're going to lead your coworkers, where you figure out how you're going to guide people and still keep them safe. And, it's hard to convey that when you're in it.
Mm-hmm.
And I just think that maybe sometimes it would help if somebody would be able to speak up and say, this is how you do it. And it's not the same way for everybody, but I think it's helpful that they know they're not alone. Yes.
What a key statement there. They're definitely not alone. I don't even know the number. I mean, nurses there are. So you definitely, when you're in nursing, you're truly not alone, although it may seem like it sometimes, but you're not.
Yep.
So that's a great statement there. So let's see, if you had to use one word, what do you think that word would be to describe what your experience was like in working in the COVID ICU?
Challenging.
Okay.
Yep.
Fair. Yep. So in the beginning, when they first declared it, do you feel do you feel like you had any idea what was coming?
I had an inkling, and that's about it. Okay. I knew it had the potential to get bad just from the videos and things that they were saying from other states like New York.
Yeah.
Where things were bad right off the bat.
Yeah.
And then we had kind of a little reprieve, and you kind of kept it in the back of your head, but you didn't really get it until it happened.
Yeah. I think that's also interesting. I think it took some longer than others to get it for sure. But
right.
So tell me your thoughts on PPE. And I don't mean specifically, my hospital did or anything. But I mean, that was kind of something, especially at the beginning, that was the front of the conversation. So when you think of PPE in the pandemic, what do you think of?
Well, when we were first started this, we were going into COVID rooms and we were changing our gear out every time, just like we did with every other patient that was on precautions like that.
Mm-hmm.
And I don't think we understood that there would be a shortage. I mean, it seemed plausible, but it didn't seem possible. And
Right.
with all the stuff out there, and then I think it almost got laughable for a while. You could wear your bandana to work, or you could cover your face with a sock.
Right.
And I thought, oh my gosh.
Yeah.
And people hoarding masks, and people hoarding gloves, and people hoarding toilet paper. It just got so outrageous that then you thought, well,
yeah,
heck, if it's this outrageous with this, anything could happen. And I think then, we got down to business and fairly quickly. It didn't seem possible that we could run out. It didn't seem possible.
Right.
But
Right.
the deeper we got into it, the more real it became. And it just was a real scary thought to think that, gosh, I might have to go live in my camper for a while so that I don't expose my family. I mean, you're almost knee deep, 12 hours a day. What do you do?
Mm-hmm.
So,
yes.
and it didn't seem like that was a lot of the public's concern either. And I think that led to some anger, that we would hoard toilet paper and masks when you know that the hospital is full.
Mm-hmm.
Where does that come from? And I know it was just a fear for the entire community, but there was some definite feelings to work through just to be able to get up and go do your job every day. That
absolutely,
healthcare workers were kind of on the back burner.
Mm-hmm. Yeah, a lot of emotion in a lot of different ways. And each time I speak with somebody and their experience, I think I hear of something that's like, I never really thought of that. That wasn't, everybody's had some unique experiences for sure.
Right.
Do you, this will kind of lead into your comments about, your family and things like that, kind of a segue into how do you, what did you do as far as your uniform and stuff? Were you fearful that you were going to bring that virus out of the hospital?
Yeah, actually I was. When it first hit, they had uniforms for us to wear there. So we'd come to work, we'd change out of our clothes, put on scrubs from the hospital. And I think that they realized that in the long run, the expense was going to be astronomical. So then I just had I had 3 different sets of uniforms that I wore specifically for work. And, until the pandemic was over, I was like, well, I just get new uniforms when we're done, and I went to work and wore my uniform and my shoes. And then when I got to work, I did my job for the 12 hours, whatever. Before I left, I went into one of the bathrooms and back by the break room, and I changed out of everything right down to my socks and underwear, put on another set of clothes. I had hand sanitizer in my bag, hand sanitizer in my Jeep. I had sanitizer wipes in my Jeep. I'd wipe everything down before I got out. When I got home, come in the house, toss everything, including the clothes I was wearing and that pair of shoes, into the wash, washed everything on hot, jumped in the shower, and put on a third pair.
Yeah.
I had a stove that I could put my shoes up on, and they would be dry by morning. And so I had 3 pairs of shoes that I rotated. And I did not want to take the risk that I would bring it home to my family or my grandchildren. And so I don't have any kids at home anymore. So that helped.
Yeah.
But just me and my husband, I didn't want to bring it home to him either.
Sure.
So we just didn't have any holidays, didn't have any dinners, didn't have any family. We had, a steak for Thanksgiving, and we just were careful.
Yeah. Yeah. So, so you kind of touched on that a little bit, and my next question was going to be, how did you handle coming home to family? what about, do you feel like there's, did you have any experiences with dealing with family and when you talked about the holidays and people having different of opinions than you did? And if so, how did you maneuver through some of that?
You know, my kids have watched me be a nurse since they were in diapers. So when
Sure.
mom says that this is not a good thing, it's not a good thing. And
Mm-hmm.
so I didn't have a lot of argument out of my kids. And, you know, as far as my grandchildren and stuff, I said, I won't take the risk. I mean, I will drive up there and do a drive-by and see you all through my car window just so I can lay eyes on you once in a while, just for
Mm-hmm.
my own sanity, just to
Yeah.
see that you just have to see that people are okay.
Yeah.
There were some differences of opinion farther down the family.
Mm-hmm.
And, you know, I have to let people have their own opinion, you know,
Sure.
even as far as like things like vaccination. You know, I made a big deal when I got my vaccination. I felt like I was part of something bigger. And I wanted people to know that I was taking the next step to protect not only myself and my family, but my community.
Yes.
And not everybody met that with, oh, congratulations. I'm so glad you got it. I'll be in line too. And I kind of had to get off of social media for a while because a
Sure.
lot of comments that I made me angry. And I kind of had to just let people do what they want. It may not be right for you, but it was right for me, and I'm proud of myself. You
Yes.
know, and as far as, you know, dealing with my friends and family, you know, when I got off work, a lot of my friends are nurses, so we kind of leaned on each other when we had a bad day and needed to have a good cry. Maybe you don't come home and tell your
Absolutely.
spouse about it necessarily because you
Yeah.
can't tell them all those things. They just see the part where you're coming home and showering and you don't get dinner till 8 because you had to shower and do laundry and put it in the dryer and put your shoes out to dry. And, you know, you didn't tell them about the things that you saw and did at work that you never thought you'd do,
Yeah.
never thought you'd see, never thought you'd treat and try until you couldn't try anymore and it still didn't work. You know,
Mm-hmm.
and I just kind of had to bottle a lot of that up. But we did have each other at work to kind of talk to. And there was several times we just kind of sat and debriefed for 15 minutes before we got in our cars to go home,
So
just to go
important.
home sane enough to deal with family.
Absolutely. So important. And that is kind of a side note. That's one of the reasons I want to do the videos and the giving this platform and let, you know, nurses and respiratory therapists, techs, all the people that were, you know, in those rooms with us, is that we are a little bit stoic, and
Yep,
that's one of the reasons we could do what we can do, and that's also a negative. So it's both.
it is
It's
kind of a
good.
double-edged sword.
It is absolutely. So yeah, that debriefing and just telling the story. So yeah. Okay. All right. So um you also mentioned this just a little bit. How let's see, how would I word this? And I don't want to be, you know, argumentative at all. How did you handle, it was we were barely we as in the people that were going in and taking care of the patients,
Hmm.
we were just trying to get through and keep pulling ourselves up and out the door and back to the hospital. And but I mean, I'm going to assume you would agree with that. We were just trying to get through.
Absolutely.
Yes. Get through our
Absolutely.
days, not fall apart ourselves, and continue to stay in the fight.
Right.
So, you remember any specific days or emotions, and if so, how did you handle the absolute hurricanes of information and arguments and different ways of thinking? I mean, there was so much happening
Right.
outside of the hospitals. So how did you, you did mention that you had gotten off social media sometimes, things like that.
I just kind of had to put it on the back burner. You know, when I walked in the door, I became a different person. When I walked out the door, I became a different person. You know, then I could be a wife and a mom and a grandma. when I walked into the doors, I had to be the charge nurse. I was going to figure out how to get my staff through the shift,
Yeah.
you know, and I think there were more than once, you know, that we, like I said, we leaned on each other, but there was a couple times, you know, that, you know, you just had to go home and have a good cry. And, you know, I got fortunate. I had a spouse that just let me do it. Didn't ask any questions, didn't say anything, just sat there.
Very good.
Sat there with me. And that's about all you could do.
Absolutely.
I think it would have made me absolutely crazy to try and balance the two in either environment. I can't balance my life outside the hospital with COVID in it, and I couldn't balance my life inside the hospital with what's going on outside, the riots and it just, whoop. Okay, where'd you go?
I'm still there. You are. You're
Okay.
back. Okay.
I just kind of had to balance the two, you know, and just kind of stay out of each side. It was very difficult sometimes, and you know, and I think maybe the hospital environment was so stressful that sometimes you just came home and you didn't even want to see people. So being at home and staying safe and wearing my mask, and I mean, we didn't go anywhere because I really didn't want to. Be honest with you, you know, it just was kind of it was a difficult time. I think we had a couple of weeks in November that got really, really hairy, you know, and I'm in a small hospital. But we had, I think, 9 deaths in like 36 hours. And we did a lot of FaceTime, and the charge nurse, we were trying to, you know, we were intubating, sedating, paralyzing as fast as we could to try and keep people, you know, alive and get them prone. And I've never worked so hard, nor tried so hard, nor had all of the knowledge in the back of my head from 27 years of nursing and had nothing work. Nothing worked, you know, and it just was like you just went from one failure to the next, and you had to put your smile back on because you needed to go back down that hall to the next patient's room and be there. You know, we're going to try everything. We're going to do everything. We're going to get your family on the iPad. And you just had to put it out of your head what you just did in the previous room. And you know, it was difficult. Mm-hmm. It was just like you just left some days just feeling totally, totally defeated. Mm-hmm. So, but my grandkids, you know, they Snapchatted me, and they, you know, iPadded me, and on the way home from work, and so it was good.
Yeah.
You just kind of figured out how to get your perspective straight before you went home. Yeah.
Yeah. I want to, if you're okay with that, expand on that just a bit, and that environment, as far as the trying, nurses take a lot of pride in having knowledge and having not always the answers, but we know how to find the answers and know how to direct and guide and suggest. And we're asking docs if we can try this, and what about that? And so to be in that moment, especially being a more seasoned nurse, I just want to reiterate for anybody that's viewing, if they're trying to understand what we've gone through, it's a very difficult place to be. And it's like a constant punch in the stomach to not have any answer, and not, you know, to be so out there on a limb, trying and wanting so desperately. And it was life and death. That's what it was. And yes, in nursing, we do, we expect, you know, that you've got one down the hall, you know, who's ill enough that they're probably going to pass away, and you're dealing with that. And then you've got one down the hall that just needed stitches, and we're kind of used to that a little bit, that juggling. But on that scale, it was just
It was
bam,
all that.
bam,
Right.
bam, bam, just constant, absolutely constant. And the the nurse next to you who you might lean on, who will give you a pat on the back or give you a hug because they understand what you're going through. And we couldn't even, we
Is in the
really
same
didn't,
boat.
it wasn't the same because they were doing the exact same thing. So everybody,
Right.
you might have, I'm just going to go for an example. You might have 10 nurses on the floor. I know that's a lot for the smaller hospital, but 10 nurses on the floor, and literally 6 of them are doing everything they can possibly do just to keep the patient alive. And
Right.
and a lot of times they did not keep the patient alive, and they were just going on. So anyway, I didn't want to make that horribly graphic or anything, but I just wanted to.
No, and it was difficult, I think, too, because not only are the nurses, pretty, like you said, they pride themselves in that they can care for the patient and make suggestions and things like that. And then there was this. And then you had not only us, but the respiratory therapist had tried everything they knew to do. And so did the physician. And we all just kind of looked at each other like, I mean, what do you mean nothing's worked?
Any ideas? Yeah.
Yeah, nothing's worked.
Yeah.
And it's the nature of the beast. And it was a lot of effort. Yeah.
It was not a good place to be.
The whole team didn't know. Yeah, nobody knew how to handle. This was a different monster altogether. This is a different beast on a different planet. This was different. I've never done anything like this.
Right.
And we didn't have it as bad as some places. I mean, we were fortunate and kind of got out of it in mid-January. It was letting up and looking a little better. Mm-hmm. So, I mean, we didn't have it for a solid year. I think we'd have had a lot of nurses start dropping like flies.
You did, or you would have?
I think we would have. We would have. We have had some staff that has went to other departments and things, but younger nurses are still exploring where they want to be too. So I can't say that it was because of that. I think that it's a combination of things.
Yeah. The whole baby nurse thing, for people that don't know, we call brand new grads, for some reason, a lot of times we call them baby nurses. And just because most of the time we take them under our wing and, help find their way. So that is another element of what we went through. Bless their hearts. I mean, what they have gone through and what they're struggling with now.
Their orientation has just been trial by fire, literally.
Yeah, definitely. Okay. Would you, I think one of my questions was how did it affect your relationships? But it sounds like you did okay there, and you had some significant support there, the best that they could. So
yeah. I think you just kind of have to put it in perspective a little bit. I won't say that I was the same person I was before. It's hard to put that out of your mind, so sometimes your family thinks that, well, mom's got a day off, so she's fine. She's fine. You really didn't leave it at work sometimes. You didn't sleep well, and you didn't, there were some side effects from it, and you didn't enjoy things maybe quite as much as you did before. But yeah.
Let's see. Did you ever consider walking away, and why did you not?
No, I didn't.
Okay.
It never really crossed my mind to do that. Okay. I mean, there were days I came home and thought, God, why did I? This was such a good career till just now. Yeah. I could be like working in a bank. Oh, wait, the bank's closed. I could be just, but no, I didn't consider leaving. And a lot of it was because of the younger nurses. And a lot of it was because, I think that it made a difference for me because I grew up in this area. I mean, I was out of state for 8-9 years, but this is actually where I started. So I came back to the hospital I left, if that makes sense. So it almost feels like home. About 70 miles from where I grew up is all. So, I mean, when in the big picture, this is my home, and I don't, I kind of felt like it would be like deserting my family.
Yeah.
So it just didn't
Well, for
cross.
those that are watching this, I've actually worked with Temple. I did an assignment at that hospital. It is a great community. I
It is,
absolutely agree. It's a great community.
except for
So,
the snow.
oh my gosh, that's a story. There's some stories. Yeah. I actually enjoyed playing in the snow. It was the blizzard parts of it that were a little bit of a struggle.
Right. The no visibility thing.
Oh, right. Yeah. Please don't leave work because you'll never make it back thing. Yeah.
Right.
Yeah.
And they're not kidding.
Yeah, they're not kidding. Yeah. Okay, Temple, this one might be a little bit tough. I know when I did my own, this one was a tough one for me. So,
Okay.
do you feel like did you have any experiences and are there any patients that really stand out to you that you're going to carry that experience with you for a long time or forever?
There were a couple.
Mm-hmm.
There were a couple. With children, fiancés, I mean, doing the Zoom, they got to see their family members, but it was hard to convey to them that I'm going to hold your dad's hand. He's, and they've got questions and the doctor's not in there, but there's the nurse. And there was anger and there were tears and there were different things. And you just have to just be there. And that was hard. And I'll probably carry that with me just because, it was tough to see and tough to watch. And then while we were doing that, both of my grandparents were in the hospital with COVID, and my other grandmother died. And so there was no visitors. And so it was I wanted to be able to tell them, I know where you're coming from. I mean, I get it, but you can't do that. You have to just kind of keep it to yourself and be the neutral one that can answer their questions and address their fears. And there's just no way to do that when I get it. I couldn't hold my grandma's hand when she passed away. I get it. But so that part of the experience, I think, is what I'll take with me. And so I think in my nursing practice since then, I think that I have been better about, listening to their fears. Sometimes you get so busy that you're just like, okay, you're talking to them on the phone and you're just like, oh my God. And now it's just like, okay, so tell me what it is that you need to know. What is going to make you understand what's going on and how I can help you ask the right questions so you can make an informed decision. And I think I'm better at talking to patients' families. I think I was good at it before, but I think I see it in a different light now. And so it's maybe not so much the experience with the COVID, but my own personal experience with the COVID, which then goes back into, well, now my friends and family just finally got it, that people can get sick because grandma and grandpa got it. And they're still not done with it. So, now I think that it kind of was an eye-opening experience for everybody. But from my own personal experience, that was hard. And it was hard to call up and see how my grandparents were doing and be the person on the phone that needs information. And just in the last few weeks have I gotten to see them, that they've opened up where they're at to let me see them. So it's been a long year, to say the least.
Yeah, but my best friend is she was an infectious disease nurse for long-term care facilities when in the worst part, and it was hard. It was so hard for them also. Yeah. Mm-hmm. So yeah.
And it was, and you knew that it was out there. But on the other hand, I thought, I'll just, grandma and grandpa are fine. They're in the assisted living. They're safe. Yeah. And then they got it there. So it was tough. Yeah. Tough to deal with.
Yeah.
So.
Oh goodness, girl. And I'm so sorry. I had no idea about your grandparents and your grandma passing away. I'm so sorry you had to.
Oh, it's been a year.
Since you lost her?
No, my grandma passed away in October, and my other grandparents on my mom's side got COVID in November, and they're currently in a nursing home. They never bounced back completely. So they aren't able to be independent anymore. And now they both have dementia. So it's been tough.
Goodness. Yeah. And that, of course, we didn't even know when we were in the very beginning of it, that not only did we not know what to do about it and how to cure it, but it wasn't, even if the few that comparatively, no, I shouldn't say the few. There's a lot. Few is a really bad choice of words. A lot of people survived it. To what end? Yeah,
That's
there's
right.
a lot of people that
That's
are still very much suffering from
and yeah, very much suffering, and will have suffering for many years. And I think, now that, people are like, in the community, they're like, well, you guys, you've gotten a break from COVID. And yes, we have, sort of. We don't have the active cases. Now we have the long haulers, the ones that are suffering with, long-term dementia, long-term lung disease, clots, strokes, heart disorders, you name it. All the things that come with that. They had COVID in October, November. Now we've got a hospital full of that. So it's kind of like still dealing with COVID.
I will tell you that you're not the only nurse I've heard this from, as I'm, pre-screening and chatting with nurses from everywhere that want to tell their story. And right. It's just as you said, it's the now the effects after the COVID. There's also the inundated with patients that weren't going to the doctor when everything was so scary, and so their right. disease processes are out of control. So right. While people may think that the nurses are having a reprieve,
we're just having a reprieve from PPE. That's really about it.
Yes, correct. There's still a lot of patients. There's You're still right. a lot of patients, and they're also another reason for me wanting to use this platform to hopefully help people understand right. that while we're out of one woods, we're in another one now.
Right. Because now we've got the long haulers, but then they opened up surgery.
The disease processes that are so out of control, and we had no opportunity to. This is not nursing as a profession is really bad about fixing the emotional side that we go through, and right. debriefing and handling it and telling the story, getting it off our chest. We're tough, we're going to stay tough, and we're going, but this is bigger than that.
It is.
What we've experienced is emotional trauma. It's a mm-hmm. very, very significant trauma. So now I feel like, I know a lot of stories, unfortunately, that nurses are emotionally really struggling now because the COVID has, led up to some extent. I mean, in a significant way. Mm-hmm. But they're still left with the pain, people falling apart after the crisis. That's kind of what's going on. And right. the crisis, the COVID crisis, hopefully is over. But we got to find a way to get ourselves emotionally stable again so that we can continue doing what mm-hmm. we do. So, yeah.
Right. Yeah.
Let's see. So I think you may have answered this. You're still in the same role then. You're still
Yep.
Okay. All right. What would you say? And I love this question. What would you say you're most proud of in yourself and your colleagues from the pandemic?
The teamwork. Wow. I think that before we had a really good team, and everybody did exactly what they're supposed to do, and everybody went, above and did the extra mile when they needed to. And now, you just don't even have to question it. You know, if there's something that needs done, 3 people will jump in, and everybody's on the same wavelength. You don't even have to ask people to help you because they've already thought of that. They've made it through this pandemic, still working on it, but I mean, they've made it through this, and the teamwork has just been astronomical. I mean, super proud of all my coworkers, super proud of the other charge nurses, super proud of every department in the hospital, really. You know, there's not one department that could have done it without the other. I mean, we still had to have housekeeping. We still had to have meals coming. We still had to have respiratory therapists and doctors and radiology and everybody. The lab, you know, we drew our own labs and stuff, you know, with the positive patients, but, you know, somebody still has to run those. Somebody still has to, I mean, there's just not one person that you could have done without. And now there's just no question of what they will do because you've seen it.
Right.
I mean, if you have to have something done, you just call them because you know they'll do it. And you know that they'll do it to the best of their ability. It's just not a question anymore. So
yeah, agreed. Yeah,
the dependability has just went up astronomically.
Yeah, so that's so true. And you know, I don't know as though I've even thought of it, but yeah, the bonds that are there now between the workers is pretty profound. You're absolutely 100% correct on that.
Right.
So is there, when we first started talking about doing this interview, and you've had time to think about it and things that is there anything that you wished I'd asked you, or is there anything that when this is done and we get off this Zoom call that you wish you would have told whoever happens to hear or listen to the video?
Well,
I mean, just anything you'd want to get off your chest, for lack of a better term. But
I think just that, I hope that nurses are strong enough to seek help if they need it. Find somebody that they can talk to, somebody that understands where they're coming from. I think the strength comes from a lot of different places. I mean, you got to pull it wherever you can get it.
Yeah.
When this is all over, I think nurses are pretty tough people.
Yeah.
So
absolutely.
Otherwise, I can't think of anything that I wish I'd gotten off my chest.
Okay. Yeah, and that's good. I mean, we've had a really great chat. So, anybody you want to give a big shout out to if they see your video?
Just my staff at the hospital I work with. They're wonderful. I couldn't imagine us coming through it without any different team. I mean, just been it's in that respect, it's been a great experience.
I have to tell you, I came to the hospital. I mean, I left your hospital and went to the next hospital where the pandemic started. And right at first, because I didn't know a lot of people yet, I was like, I want to go back to Temple's Hospital. I want to go back, but
that's a great team.
I have to say that I've worked at 2 different hospitals and both places had incredible teams. So it's the nature of what we were going through that,
Yep. You just kind of had to grow them.
Yeah. There was no more little issues. Most of the 99.9% of the time, nobody had time for that. So
yeah, nobody had time for anything petty.
Yeah. So tell me, where do you see yourself in 5 years? What's next for Temple?
I'll probably still be here. As I get to be a more and more seasoned nurse, I don't know what opportunities will roll up, but it'll be ICU related.
That word seasoned. Sorry, I interrupted you.
It's okay. I know what seasoned means.
I totally interrupted you. I'm sorry. Go ahead.
That's okay. No, I see it being in something critical care. I see myself still being in critical care of some sort. Not sure what, and I'm sure here. So that's where you'll find me.
Yeah. All right. Well, and that's pretty much the all of my questions. And I have to tell
Okay.
you, I have no doubt that you were absolutely incredible. You
Oh,
were
thanks.
incredible when we weren't in a pandemic, and I have no doubt that you did amazing things at your hospital. And I just want to personally thank you for that. And
Well, thank you.
I
I'm
hope
sure you did as well.
in the
I missed
future.
working with you.
Yeah, yeah, it was. Yeah, I missed you too. So, and then if you want to share, I'm gonna get this loaded. And if you want
Okay.
to share it, definitely share it. You don't have to share it. And if you know anybody else that feel like it would feel good to go over some of this, just have them
Okay.
reach out to me. And viewers, whoever's watching this, same. If anybody feels like they want to tell their story or they have things they just want to chat about, reach out to me. All right. All right.
All right.
Thanks, Temple. Appreciate you.
Thanks. You bet.
Okay. All right. Bye.